Good afternoon, guys, or evening, guys. This is your discussion B. Title is Why Older Adults with Mental Illness Face Limited Access to Care. Okay, I'm going to go through that for you for B. So please join me for discussion B. Okay, why older adults with mental illness face limited access to care. As older adults with mental illness age, they encounter a web of systematic, clinical, and social barriers that restrict their ability to receive timely, appropriate, and effective care. These barriers are not isolated. They compound one another, creating a landscape where even treatable conditions often go unaddressed. Structural policy barriers, Medicare limitations. While Medicare covers some mental health services, it often excludes key supports like long-term therapy, intensive outpatient programs, or integrated behavioral health models. Coverage for substance use treatment is especially limited. Out-of-pocket costs, co-pays, deductibles, and non-covered services can be prohibitive, particularly for low-income seniors or those on a fixed income. Fragmented systems. Mental health services are sold from primary care and aging services. Making navigation complex and discouraging. Continuity of care. Workforce and service gaps. Shortages of geriatric specialists. There is a critical lack of psychiatrists, psychologists, and social workers trained in aging-related mental health, especially in rural and underserved areas. Overburdened primary care. Primary care providers often serve as the first and only point of contact for older adults with mental illness, yet many lack training or time to manage complex psychiatric or substance use disorders. Limited cultural responsive care. Services often fail or reflect the cultural, linguistic, and historical context of diverse older populations, reducing engagement and effectiveness. ageism and stigma, misinterpretation of symptoms, depression, anxiety, and cognitive changes are frequently dismissed. As normal aging, delaying diagnosis and treatment. Internalizing stigma. Older adults may be less likely to seek help due to generational attitudes toward mental illness, shame, or fear of institutionalization. Provider bias. Clinicians may unconsciously deprioritize mental health in older patients, focusing instead on physical ailments or assuming diminished quality of life expectations. Evidence and screening challenges. Poorly validated tools. Many screening instruments were developed for younger populations and don't account for age-related changes, comorbidities, or cognitive impairment. Research neglect. Older adults are underrepresented in clinical trials, especially those with multiple chronic conditions, limiting evidence-based guidance for treatment. Diagnostic complexity. Symptoms of mental illness may overlap with dementia, medication side effects, or chronic pain, complicating accurate assessment. Partial and practical and access challenges. Transportation and mobility. Physical limitations, lack of transit options, and inaccessible facilities make attending appointments difficult. Service deserts. Rural areas and some urban neighborhoods lack mental health providers, especially those accepting Medicare or offering home-based care. Competing health demands. Seniors often juggle multiple medical appointments, making mental health care feel secondary or burdensome. Digital divide. Telehealth expansion hasn't fully reached older adults due to technology, access literacy, and secondary or sensory impairments. The interlocking puzzle. These barriers don't operate in isolation. A senior living in rural area may face transportation challenges, lack of local providers, and Medicare restrictions, all while managing stigma and multiple chronic conditions. The result is a system where older adults with mental illness are routinely underserved despite the availability of effective treatments. What's needed? Integrated care models that combine physical, mental, and social supports. Expanded training in geriatric mental health for all providers. Policy reforms to improve coverage and reduce cost barriers. Community-based, culturally responsive outreach and education. Investment in research and age appropriate screening tools. This isn't just a health issue. It's a matter of equity, dignity, and systematic accountability. Addressing these gaps requires coordinated action across healthcare policy and community. Sectors to ensure older adults receive the care they deserve. Okay, guys, so that is B for you. I will be back on with C shortly. Give me a bit for C, please, and I'll be back on with that for you. For now, Gator Wellness, take care, folks.